Let's get started. So I know that there's Lauren. Okay, come on down. You got your break. So this is the final panel. And so we have on this panel Richard Dennison from Environmental Defense Fund, Joyce Tsuji from Exponent, Morris Wayland from European Commission, and Lauren Zeiss from Cal EPA. And we have a series of questions which I can see in front of me, and I hope you can see in front of you, that try and cover a lot of ground. And we'll try to stick to these as best we can. But I wanted to point out that the title of the session is really Perspectives on EPA's Approach to Designing Next-Gen Risk Assessment. And if I could say one thing about this entire panel, is that they have a lot of understanding and expertise about how risk assessment is done and what its purpose is or ought to be. And so before we really delve into the nitty-gritty, I wanted to give everybody an opportunity to make some comments just about how they feel about EPA's approach, and feel free to be critical or complimentary as you like. And I'm going to start with you, Richard.
Great. Thanks, George. And I am going to only bear a loose relationship to the questions behind you, but I will address the topic for the panel of perspectives on EPA's approach. I want to start by kind of representing a community that is not really here, and that is a community I deal with quite a bit, which is environmental and health NGOs who are highly skeptical of risk assessment and, frankly, the overall system we have in place for chemical safety testing and assessment. And they see this system as largely ignoring or obfuscating their concerns and what they see as real-world issues. And many of these have been mentioned already in the last couple days. The one chemical at a time approach, when in fact we know we're exposed to multiple chemicals, the inability to assess cumulative impacts from chemical and non-chemical stressors, the general short shrift that vulnerable populations, including by life stage and by disproportionate exposure, typically get in risk assessment. The difficulty in our testing systems of getting at chronic, higher level endpoints of concern, like things like developmental neurotoxicity, et cetera. And the fact that overall risk assessment and our system tend to provide what is perceived to be a very uneven playing field, unlevel playing field, where industry seems to be able to game endlessly the system and drag out decisions and assessments for decades, and we've seen many examples of that. And when they finally do get out, those tend to be immediately challenged, and then we go through another round and another round. And that endless cycle, I think, is producing a lot of skepticism. So when I look at next-gen approaches, I ask the question, how do they deal with those that skepticism, if you will? And I personally think there's enormous potential for that to happen. But that EPA needs to do a far better job in explaining first that those are key goals of addressing those deficiencies, are key goals of this work. And second, precisely how the assays being developed and employed in a next-gen context and the way in which they're going to inform decisions, precisely how they are going to address those very concerns. And we've heard that in general terms, but I think what is necessary is a translation into, I think even having a single fact sheet on each of these issues. How are mixtures going to be addressed through next-gen approaches? How are cumulative impacts going to be looked at? How are life stages being addressed or could be addressed? What's the potential here for us to really finally deal with a lot of these issues that we've been talking about for decades? Otherwise, I think this just has the risk of becoming another big black box that is perceived from the outside, at least, as another set of ways in which people can argue endlessly about this issue and not reach decisions. The second point I would make is that I see somewhat of a paradox in that a lot of while science is informing this whole new set of tools, is providing us a way forward in many respects, science is also pointing to new complexities in this arena that make it hard to see exactly how moving away from animal-based models is going to solve and actually incorporate the new complexities. And a couple of examples. The role of the microbiome. How do we begin to model that in these kinds of new systems? How do we deal with the fact that there are multiple stressors that are interacting with each other and leading to impacts? Things like the role of nutrition and health status in determining susceptibility to disease. Insights from epigenetics that are suggesting that we are dealing with cases where an early life exposure may predispose one to developing a disease later in life. How do we begin to model those in next-gen type approaches? And I think if we don't address those new complexities and start thinking about how we're going to get answers to those things through new approaches, we're going to miss the boat in terms of a lot of the new understandings that science is pointing us to. The last point I want to make is really a broader one, and that is that all of this plays out in a broader policy context. And I really have to ask the question seriously, and this may be a little bit of a down note. Can these new approaches ever fly in a policy context that I spend much of my work life trying to fix? Lauren described yesterday that the 1983 Red Book's premise was that we need a system that relies on inference because direct evidence of human harm is a very rare thing from chemical exposures. I think all the science that we have reinforces that the simplistic notion we've had at some points in the past that we could ever get to a point where chemical X causes disease Y in individual Z is largely a fantasy, and there are very few examples where that's the case. In fact, diseases are multifactorial. Chemicals interact with our genetics, interact with our dietary systems, infections, all kinds of complexities there. So what the science is telling us is that the policy construct we have, which implies that we can do that kind of causation, those two things are a mismatch. And that policy context where I work, at least in the area of the Toxic Substances Control Act, demands a level of proof of harm, virtually harm to people, before action can be taken. So not only do we have a no data, no risk concern, we have a no people harmed, no regulation system. We have in the face of uncertainty, no action is taken system. Now that's the policy construct into which all of these data and new methodologies are going to have to fit. And I would argue that next gen is not going to fly in that context until and unless we change that paradigm to one that acknowledges what the science is telling us, that we must be able to make decisions before we have amassed overwhelming evidence of actual harm to people and the damage has been done. And otherwise, next-gen approaches are going to be very hard to sell, and they will either not be used to make regulatory decisions, or they will be used in the context of a double standard, where if the approaches exonerate a chemical, they're deemed to be sufficient and valid. But if they flag a chemical, they're immediately attacked as incomplete, insufficient, and flawed, and having to lead to further higher level types of testing. And if we have that kind of system where we can't rely in both directions on decisions that are informed by these new methods, I think that's a policy context that is not going to allow these new approaches to thrive.
Thanks, Richard. Joyce?
I'd like to echo Richard's comments that these new methods show great promise and potential to address the many problems that we currently are facing with risk assessment. The existing methods basically ignore mode of action for the most part. I mean, there are some chemicals that have more detailed information about that, but for the most part, when you test chemicals in animals at high doses, and then just use uncertainty factors or default modeling procedures to then come up with your values, you're essentially ignoring mode of action, what's really going on at low doses. I think the new approaches will allow a better will add to the weight of evidence of the existing knowledge on chemicals and help inform, hopefully, mode of action at low doses, which is really where we want to be dealing with in trying to figure out if these chemicals can cause any harm. And hopefully we can capture those key early events that might lead to harm. Now, the real difficulty, of course, will be scaling up and deciding, okay, which events will then lead to actual effects at the whole animal level, and also having good tests that are predictable of what actually is going on in the body, and you don't have any errors actually within the test or artifacts of just the testing methods or something. I think a lot of that is hopefully going to get worked out. Hopefully we'll look at these tests much like, my background is in comparative biology, so it's kind of like the evolution of the clam. Before the clams invented the siphon, there was only one type of clam, basically. It wasn't very big. It stayed near the surface of the sand. It really didn't do much. It couldn't invade a lot of environments. But once the clams had the siphon, they diversified into a number of different types of clams in different types of environments. And hopefully the same will be true of these new methods. They'll allow us to have better and more refined risk assessment. So I'm very hopeful about that. I think among all that, I hear the comment by Donna that we don't want to overdo it to the extent that everybody then throws the baby out with the bathwater. And I think everybody's going to have to everybody from wherever you come from will have to get over this kind of distrust of different risk assessment methods. And also I think there's a basic distrust of science in society today, both on the part of the public, on the part of regulators, and even scientists of different scientific methods. So I think we're all going to have to kind of set all that aside and look at it as objectively as we can and use what knowledge we have, as Maurice said, a kind of a knowledge-driven approach. That being said, I think some of the things that I've heard of EPA's approach seem very reasonable. I think the whole implementation is going to go by steps. It's going to have to be opportunistic, using tests where we can see there's good comparability between what's happening, for example, with ozone in humans and the cells from those humans, and that they express the same variability of the individuals that they came from. I think those are very powerful and very promising looking assays. I think by using and looking at chemicals that we already have a lot of knowledge about, it will help inform for those chemicals as well what's going on at the low doses. And even for many of those chemicals, we don't have good assessments of low dose toxicity. And I'm hopeful that we'll be able to put all that together in a much more powerful weight of evidence approach. So for the data poor chemicals, I want to say that maybe there's tens of thousands, or people throw out various numbers of how many of these chemicals are out in commerce, but we have very little data on them, and I've seen that myself in having to deal with some of those chemicals. But many of them belong to classes of chemicals, as Chihei Yang said yesterday, that you can make some sort of sense out of them. And hopefully by looking at chemical class, chemical structure, you can look at using these new methods to do comparisons among chemicals within the class and compare them to, often within these classes there are chemicals that are more well known, and see how they compare against those more well known chemicals. Of course, there'll probably have to be some animal data or targeted testing done to see how that stacks up, but I think that would be a very powerful use of these types of tests, assuming you can get the proper tests to look at the endpoints that these chemicals likely affect and pathways. And I think there's better opportunity to test mixtures with these types of tests and new methods. And you could see how those mixtures, how the assessment of mixtures based on these methods would compare to using the existing approaches for example, hydrocarbon mixtures, where there's thousands of chemicals within your hydrocarbon mixture. We know humans are exposed to all of them, yet there's only certain ones we pull out, and we do a risk assessment on those individuals, say benzene, toluene, xylene, hexane for the alkanes, certain of the pHs, naphthalene, and then see if you'd get the same thing if you did this testing of the mixtures. I think that would be a very powerful way. We have a number of instances where people are being exposed to petroleum spills and various other, and also background exposure, just hydrocarbon exposure. I think this would be a really powerful way if we could get this testing implemented for looking at these mixtures. And I think for the most part, it'll have to be case by case, unfortunately. I don't think we can immediately start at the cellular level and start risk assessment and finish there. But I have a lot of hope for it. And I guess I haven't heard as much in this seminar, but probably it's a topic for a different seminar, but how to integrate systems biology up to the whole animal level, I think is a whole nother several days of a workshop. For example, if you just started with some of your metals like copper, zinc, and iron, and you knew nothing about them, and you put them through some in vitro testing, you'll find that you would conclude that they're powerful carcinogens because they cause a lot of oxidative stress. However, more refined knowledge would tell you, of course, that they're essential elements at low doses, and if you have too much, they don't seem to lead to cancer per se, but they, of course, will have toxicity. So I think to the more that we can use our existing knowledge, supplement what we're learning, I think that's the way we'll have to go, and I have a lot of hope.
Thanks. Morris?
Okay, thanks, and thank you for the opportunity to. I'm going to try to keep my comments directly on the next gen thing, and here we go. So first of all, I think it's a great initiative. I think overall we haven't done enough for looking specifically at the frameworks that we're using for risk assessment up front, and we should do a lot more in parallel to the development of the actual methodologies for the scientific methods. So I wholeheartedly support these type of endeavours. And in particular, these type of frameworks, for me, focus a lot on, decision-making science. Decision-making is a science, and I think Greg's talk this morning was excellent in that sense of reinforcing that point. We need to think more about making decisions, and I think that's why, in a sense, for me, the focus of NextGen should be about how we make decisions, and then and in that answer this never-ending, recurring question of how do we use this data, So that's the first general comment. But some observations I'd make based on what I've seen in recent times is, for me, maybe the program could be more specific about who the customer is. So is it specifically EPA and the type of decisions made by EPA, or is it within EPA but at the same time addressing, a more global community? So contributors possibly don't know if they're contributing to help EPA make better decisions, or is it that EPA is providing a platform to allow us all to make better decisions in this context? So that I think that's important, because it obviously then indicates specifically what type of regulatory environment we're working in and what type of decisions we need to support. It wasn't clear to me from the presentation yesterday about the next steps. It was kind of a status report, but I didn't get a feeling about, okay, how is this program evolving? Where's now you've come here, what next? And because I'm so enthusiastic about the program, I was a little bit kind of disappointed that I didn't get a feeling about about where it's going. So I think that could be looked at. Then the case studies. I think the case studies are critically important. I said that yesterday. But defining a case study is a difficult thing. It's really like putting your cards on the table to some extent, because it kind of illustrates where you think the focus should be and what type of decisions you're trying to support. And I'm saying this because we're trying to do it ourselves in Europe. How to formulate those so that we can, put the science through its paces, but also use it as a good communication tool. So the case studies have multiple purposes, and I think we have to be more clear about what a specific case study is being set up to do. Is it just to illustrate, communicate to an end user, or is it really to almost like a kind of validation of what you're doing and so on? And if you try to do too much in a case study, it'll go wrong. So I think we have to look at those. There's also a tendency, if you pick a case study where, obviously you need sometimes to pick case studies where there's a lot of data that exists, but there's also a problem sometimes that if you pick something like ozone, you pick will some of the community who should be engaging in those case studies tend to just back off because they're fed up listening about BPA or ozone or whatever, So again, I think that's something to keep in mind. The other thing when we talk about one case study, screening and prioritization, we hear about that, screening and prioritization. But I think that's something where, again, I'm kind of, that's an ill-defined term, and it needs to be defined better, because there's an awful lot of inferences in that. It sort of means, well, look, screening prioritization it doesn't matter if we get it wrong, because it's, the bar is set quite low. But in some cases, screening prioritization is critical that we get it right in the first filter. So we need to be. Is it Greg Wolf? Is it the first name Greg? Doug. Well, sorry. Yeah. Okay. He made a good point at one of the meetings I was at recently. Can't even remember where it was, but he said, look, in our business, screening means a different term. It's not a screening assay. It's screening is a very rigorous process for us to screen out which things we need to pursue and which things we don't. So I thought that was fairly ironic, because this is exactly a person within the agency who is a customer in a sense, and him having to clarify that this term is being used incorrectly. That we have to get that right. Use the terminology in a better way. So I'd like some clarification on this screening and prioritization, because in regard again to case, so that's a case study regarding screening and prioritization. The other case study, I'd like to see some case studies that are really system biology orientated. Like I mentioned yesterday at the beginning of my talk about, some things just can't be answered anymore by empirical, observational, traditional type approaches. Let's zoom in on those, rather than trying to, we're going to help every decision and every. So, for example, like I said, there is a debate beginning to emerge about, is there such a thing as a threshold? Now, I mean a threshold in the scientific system biology perspective, not a threshold for regulation, in the sense that, it's touching on whether we understand that there's homeostasis, and that there's a system with feedback and feed forward and so on, and that this system then is perturbed by something, but it can right itself, or it can jump in a bistable condition, jump to another operating point. These things need to be talked about and illustrated, because that will be the scientific backbone to beginning to address the issue about an endocrine disruptor not having a threat, and what do we mean by extrapolation and so on. So I know I'm being a bit vague, but I'd like to see formulation of something where really we can show that the system biology can provide a solid grounding for us to conduct those type of discussions. The other thing is the case study is this hazard identification. I've got a strong feeling, and it's just a feeling, is that when we come to hazard identification and grouping chemicals associated with modes of action and so on, we'll be able to do that relatively quickly with a relatively modest amount of assays and so on. But when we want to get to quantification, it could be effectively really a quantum leap that we have to go. So one thing within the SURAP program we're kind of looking at the moment is that if we want to go to really specify a point, or derive a point of departure and no effect level at an organ level or something, that at that point we'll need bioreactors and we'll need all kinds of things, because it's the quantification that's going to be the real difficult part. Whereas if I just want to associate a chemical potentially with a pathway or a mode of action, I can do that very, very easily. So I'd like to see a case study where that's really, making that distinction showing where, as we step in. I remember the slide I had yesterday in different purposes of a test system, and as you go down there, it's not kind of a linear increase of effort to get to the end. It could be that the first two are quite easy, and then it's the next one will take 10 years, So I think we need to look in it. So that is therefore being more specific about the purpose of a system biology based test system, so that you can identify then what components you really need and what the challenges are. And the last thing I'll say is the case studies that specifically address this decision-making algorithm and incorporating things like value and really beginning to address how you identify sources of uncertainty and how you quantify them. You heard Derek Knight yesterday, where this was echoed at a global risk assessment dialogue conference held last year, which is a big US-EU collaboration. And in one of the sessions, it was explicitly said that, look, one of the reasons why we don't use alternative methods or non-standard methods is that typically the people giving us that information are no good at telling us what the sources of uncertainty are and could they quantify that uncertainty. And you heard it again from Derek yesterday that, look, we can apply extra assessment factors and so on. So it's not a reluctance to use it, but in principle, but I'm really reluctant to use it if I don't know how far wrong I'm going to be. And again, that goes back to one of the things that Greg talked about earlier about the impact of making a wrong decision. The key, you need to know that. How wrong could I be? The last point to make is about, again, to go back to this validation thing. We need to get this kind of sorted out, and we need to decouple all of these individual discussions that we're having all under the word of validation. For me, you should have that up front, that discussion. Before you develop anything in an ideal world, you'd actually say, who's my customer? What decisions are they trying to make? How do they think I can help them? And let's sit down together and define, let's clarify what the expectation is on both parties, and also what will be the measure of success? Validation has to be fit for purpose, and what you're trying to do is you're trying to establish that something works. It's success, and I don't get that feeling when we're saying this question. How do we use this data in a risk assessment? It's kind of like suck it and see, and see. Oh yeah, that kind of was useful. We need to stop doing that. We need to sit down and say, look, if I can, make this decision and in this sort of way with that, then I'll feel this is successful. And then what I need you to do for me to demonstrate that what you're proposing to be works is I want an international formal validation study signed off by the OECD, or B, listen, here are 3 model chemicals, 3 reference chemicals that if you get these right, I'll believe anything you tell me. Okay, so it's horses for courses, and let's get that established up front, because, and again, within the EPA context, and maybe it's my ignorance of the organisation, but it's never clear to me where this, when we talk about valid, the same with the EDSP 21 program, who's the customer in terms of defining expectation of validity. Is it within the agency? Is it that you need an international type acceptance, et cetera, et cetera? So let's have those discussions up front and not be frightened about them, And the final thing I'll say is, and I suppose it'll be a little bit provocative, is that I think, as this is maturing, I think we need to you can't sit in the fence anymore, right? When we're talking about using system biology to form risk assessment, are we talking like option A, and I'm going to really kind of black and white. Are we talking about, we want to use the data generation tools that have emerged within the system biology arena, and the data that they generate, but still rely on effectively correlation of observation. So I generate gazillion numbers in my experimental system, and I correlate all of those with what I'm trying to predict. And if I get a good correlation, I'll then do some kind of checking of that, and I'm done. Okay? Or is it that we really want to use the understanding of the system to together with the data to inform a decision. So I think we have to, you have to decide there where you're going. Because for me, and I said it earlier, system biology is about understanding. It's about knowledge of your system. That's why you use all of the beautiful tools that we have. But I think I'm seeing it again and again and again, and I'm going to get a tidal wave of test submissions to ECFAM where that is the paradigm. It is a model with a lot of transcriptomic data, whatever, and it's purely in a statistical-based, prediction model. And then I'm saying, here, go and validate that. And it's I think we have to be clear where we stand on this and what do we mean by system biology when we use it in risk assessment.
Lauren?
Okay, well, my last name begins with Z, and I sit at the end of a series of very insightful comments. So, and I endorse many of them, most of them, all of them, I guess. I do want to, though, underscore some of the reality that Richard placed in front of us in terms of the susceptibility of the overall decision system to accept the results and use the results, and some of the limitations that are in place now. And there is an issue of burden of proof here. And so the question, and I think that EPA's been pretty artful in thinking about that reality and designing their next-gen system to address it. But I do think that more attention needs to be paid to how we deal with that piece of the system. And there are different elements to it, and one of which is really important is that a lot of people can't play. It's really, it's a great thing that EPA, you really need to start using and doing things to understand how things work, and EPA has embraced that and gone far beyond, I think, expectations in trying to figure out how to use the new systems biology and in setting up their CompTox program and then trying to use the results of that program. But this is a very complex science, and there are a lot of players that understand much more easily the old biology, the old tests that are going to be really at a loss to understand the implications of some of the inferences coming, of the basic data and some of the inferences coming out. So how do we deal with that question, I think? And we really need to start thinking about how to deal with that piece of it. In terms of low dose, again, on a chemical by chemical basis, I don't see how we can begin to answer that question without considering some of the broader issues that that came up. For example, when we think about the overall exposome, human variability, disease states, all of these conditions that are a concern when we talk about bringing the results and insights from systems biology to the broader population. Systems biology, of course, has a good deal to say and can begin to address that issue, but it has to be done very carefully. So, again, that's another piece for future work, and I agree with Maurice, figuring out this threshold issue is important, but it needs to be done in a very careful and thoughtful and expansive way, really. I guess I do think that it's important to start doing, and I do have some tweaks to add in terms of the next-gen framework, and one of which, false negatives is really important, and in terms of prioritization, maybe the thing to do is not to, in many cases, in certain decisions, you may have enough information in certain contexts with certain signals not to proceed with a chemical, but to really focus on the ones that are negative. And I'm thinking about a case where you have alternatives that you're trying to consider. So it really is going to be dependent on the decision context what to do in that first phase. Let's see. I'm going to... rather than going over some of the, and I do think that the whole area of building in some of the structural alert and chemical alert information into that first tier piece, that more rapid piece, is going to be very valuable, and I think that it might score highly on a value of information scheme. And I think this issue of, the beginning to build, I'm thinking back to Maurice's talk and the way in which they're proceeding to build the AOPs. Well, I do have some concerns about, and some of them came up in the comments, about what is missing, what we may miss, various ways into entry into an overall physiological process that can be affected by, the same process can be affected by early upstream processes that act in a variety of ways. So there are concerns about that, the degree of rigidity that might go into an AOP structuring, but to begin to catalog what we think we know about different toxicological processes, kind of an overall wiki, might be very interesting. So I'll just, in terms of helping us move ahead and play some more with this data, because I do think we need to gain a lot of understanding throughout the various sectors that will be concerned about the use of this. I'll stop there.
Thank you, Lauren. So I'll just let me pick up on a couple of things. And first of all, the idea of a wiki or something like that, I think is really something that I have a great deal of passion for. I think that one of the things that is holding us back at this point is we really don't have any sort of systematic understanding of what the universe of mechanisms of action for toxicity looks like. I think that we could probably develop one pretty quickly as long as we had some sort of structure to do that. And I think that it would drive a lot of the process of assembling the parts that we have now a lot faster. So that might be something for us and for EPA to think about as to how one might start to actually put together what Morris and I have talked about this as an ontology of modes of action, and I think we have some pretty good ideas about how to get that done. The second thing that I just wanted to make a comment on, since I have the prerogative of doing so, is we've heard a lot over the last day and a half about data streams and about biotechnology, but we haven't heard a lot about what, other than to define systems biology several times as the study of emergent properties. We haven't really talked about how to do systems biology with these data streams. And I think that that's going to be critical. I think that what we have to do in order for this to be more than the statistical exercise that worries Morris is for us to actually be able to construct hypotheses that are testable, perhaps in silico, perhaps once they're done in silico, in real wet lab models, that will actually start to bridge the gap between our biotechnology data streams at a very fundamental level of biological organization and what it is that we're after, which is to understand and prevent disease states. So I would just, again, encourage more thought. And there is work that is going on in a lot of places to try and create those kinds of modeled simulations and hypotheses, and I hope that those start to get incorporated into the next-gen thinking. So what I'm going to do now is we've got a couple of questions from the web, which I will get to, but I wanted to, before I did that, First of all, just logistically say that because this is such a smart group of people, we've taken up 35 minutes of our hour in our preliminary comments. So what I'm going to do is spend another 8 minutes and 6 seconds going through responses that folks might have to each other, or if there's a particular question from the list that they want to take up, and then we're going to open it up to questions and everything. So that we'll have at least 15 minutes before we have to wrap up, if that's okay. So now that you've heard each other, is there anything that you wanted to respond to or disagree with, especially just to make it entertaining or informative? Or is there a particular question on our list of 5 questions that you'd like to tackle? If not, let me then try and prod you a little bit, which is, from my view, to get to the point where we do incorporate, Dean Jones's 500,000 chemicals along with a fundamental understanding of the biology that they interact with, enhance or inhibit, that there's got to be some intermediate steps. What aspects of what you've heard in terms of biotechnology and its application to risk assessments do you think that could be applied quickly by EPA, and in what context? I mean, we've talked about dose response, we've talked about hazard ID, we've talked about prioritization. Do any of these seem especially likely to be applicable and to make an improvement?
Well, I'll just start with one, and it has come up, I think. There were some charts that I think Derek showed yesterday. They're very similar charts in the U.S. around the HPV program that demonstrate how much, where data gaps are required to be filled, what reliance there is on the use of categories and read across. And I do think a near-term application is to examine those categories using these methods and determine just how well the types of assays in ToxCast, for example, support or raise questions about those categories that are based largely on structure and in some cases PChem properties. That's a near-term application, it seems to me, that would be very valuable, and it would help to bolster confidence in the read-across that we are doing in a lot of these programs.
Yeah, I would second that. That's what I was saying about how many of these categories you have several chemicals that you know a lot about, and then you have a whole bunch of them you know nothing about. I think that would be a really good application to try to make some sense out of that group and see if they really all act by similar mechanisms, and can you distinguish differences in toxicity based on the new methods. And I think the other place that could be informed is the low dose region of the dose response for well-known chemicals. I think you could try to use it to supplement the existing evidence and hopefully gain more knowledge about what that looks like, because you can't use epidemiological data to do that, and some of these chemicals don't have good animal models, particularly for that region too.
I like the idea of I liked some of your comments. You said it far more elegantly, Vee, about in terms of how do you do systems biology with the data streams that we're confronted with, and I think that captures it really, really well. That implies that you start your systems biology. That the data generation is just now a technical operational side, and that's quite a profound statement. Because if all you're doing is generating the data streams, you haven't even begun to do the system biology part. So that's a kind of I'm going to steal that statement from you and use it in other parts. And I suppose the link to that is kind of, I try to rephrase, rather than trying to, ask the question, how do we use this data? I'd like to hear, how do we use this knowledge? That would be if we can start asking that question, now we're linking it. The data is secondary in that sense. So, But I'd just like to say I'd like to think this is a kind of a revolution, little revolutions within one evolution. So what I mean by that is taking established kind of the thin layer of frameworks we have. Like, for example, is this not structure activity? This is structure activity again, isn't it? But we're just going to do it very differently. So embrace an old concept of ultimately trying to understand biological consequence of structure, but then use a whole different toolbox and approach to do it. Same things like TTC, thresholds of toxicological, are purely empirically derived thing, but it's, it's a thin layer concept that we can then revolutionize within that, how we do it. So I like the idea of, now some people say, no, you're still ultimately going to be restricted. I like that because it allows you to engage with the regulatory community more effectively, because people see where you're coming from, and then you can begin to introduce your new approaches that way and new knowledge. So.
Well, I just want to say that I agree with a lot of what has just been said, but I do think that we don't want to throw the baby out with the bathwater. There's been how many years of toxicology. We really do have some in-depth understanding about toxicology, and I think we want to be integrative in the way in which we apply these tools. And I do think we can do it at the Tier 3, more complicated assessments, to kind of explore really our understanding of variability, human variability and susceptibility. And in the Tier 1 or the earlier level assessments, to say, okay, this has been a description of mode of action. Well, is the biology, the systems biology, consistent with this, or are there some surprises there? And I think even though there will be false negatives, we will learn, and I actually have seen some test cases where we learned some new modes for things that we thought we understand the mode of action for. So I think it could be very valuable for that. And I don't think enough can be said about really building in some of our chemical structural understanding in the kind of green chemistry arena.
That's great, and thank you for bringing that up, Lauren. As you know, that's been a real interest of mine and several other people, and in fact, I would add to Richard's comment about testing some of the read across is that we've already been trying to do that with support from 50 years worth of toxicology data, and to me the next step then is to bring in some of the biotechnology data streams to see how much support or not they provide to some of the more traditional tox-based assessments, and there's ample data to start doing that now and see whether it provides some clarity. All right, let me read a couple of questions from the web, and then we're going to open this up to the floor. The first question is from Ravi Subramanian of EPA. He was here yesterday. Ravi, why didn't you come back? We spoke to the issue of validation earlier. To date, very few of the computational analyses of next-gen data have been repeated, and we need to go through the process of replication of at least a few of these projects. I expect you will see a lot of surprises in how conclusions vary. For example, scientists in a Russian group in collaboration with EPA scientists have reanalyzed the same data for formaldehyde that came out of the Hamner, and which Justin highlighted yesterday. They came up with radically different conclusions as to what is happening below 1 ppm that would completely change how we might treat the mode of action. So it's really just a comment, and not whether anybody wants to comment on that. Go ahead, Lauren.
Yeah, I think it kind of gets to this issue as we move ahead and we learn more. There's going to be some debates, and I don't think we're going to be able to get away from some inference guidelines. Now, maybe it's too early here, but as we develop this hopefully complicated and wiki, eventually we're going to have to get to some inference guidelines.
Yeah. No,
and how we do that with this new biology, going to take a lot of exploration.
But I think it's a great comment. I think, and the other, which is another hobby horse of mine, is we need to be sharing data very broadly, so that everybody's working from the same platform. And then the second web question is from Ann Summers, the University of Georgia. There's a problem of non-overlapping regulators. That's good. People need their space. For example, EPA regulates methylmercury in fish actively, and FDA regulates exposure from drugs and devices, methylate, dental, not at all. but all forms of mercury are actively intertransformed in the environment and even in humans and their microbiomes. One or another exposure affects 80% of the population and are believed by various groups to have effects, but inorganics in general, including mercurial compounds, are not on either the US or EU list of chemicals to test. Is there a resolution to this at the policy level? I'm actually going to punt on that just because that's a big policy question that we're not equipped to answer. So let me get to the folks here at the microphones. Please go ahead.
Hi, Paul White, EPA. And I'd first offer us a little thoughts about the Human Genome Project as an analogy for our effort. And maybe it's a rather useful analogy, a little less the fact that the human genome could be sequenced with application of enough skill and technology and funds. But now the question, having this sequence, how is it driving modern medicine? And I bet there are IOM committees that are getting together to discuss, that next gen effort. So I think it's less the matter of, having enormous amounts of new data and the question about how we treat all this as scientific contributions and use it to strengthen our analyses. And along those lines, I'd suggest, there's the old expression that the perfect can be the enemy of the good. Well, here perhaps a comprehensive could be the enemy of the valuable. If we're looking at this, that we have success when we start replacing wholesale pieces of toxicology, that's a fairly high bar. If we can talk about success when we start using information on particular toxicity pathways to evaluate untested chemicals and have some examples of that, that could be a great success. And one area where there is a lot of data, and it's the genomics data that toxicologists are routinely producing now, and I think it's particularly relevant when you have the type of toxicology studies, and this was type of studies Ravi was referring to in his question, where you basically reproduce bioassay conditions and look at genome-wide expression information. And I think there's a great deal to be done in terms of establishing an appropriate way to evaluate that data. And right now, I think we're sort of at a very preliminary stage there where people have been looking at, numbers of genes in different categories that are expressed more than a certain fraction above background. And, well, I guess a sort of toxicological principle holds that, that ought to fall off as you go to low dose. You're not going to have lots of genes expressed to a very large margin at low dose, you wouldn't think. So how should we really be evaluating that data that's, now being put on the table? And if we can show some good examples of using that for important chemical analyses as well as looking at the untested stuff, then we'll be advancing the field to everybody's benefit.
Thanks. Good comments. Bill?
All
I think it's a very important point, but I do think that also there's some integration across the two as well. So it's not clear to me. I mean, I think in some cases it might be one versus the other, but you should be able to also understand the what happened in the animal under the old toxicology using systems biology methods. So part of this issue of dose response might be some exploration around substances that have been tested at high, low, intermediate doses, and then in consideration, and it's not clear to me exactly how you do it, but the background environment of the animal. See the extent to which we can really understand the animal. Yeah. I think though there is biological consistency, so I think that kind of consistency will actually reinforce our understanding of the systems biology answer. I don't know if that makes sense, but in a way there's a progression from the high to the low dose, and we need to understand those.
And one more quick one.
Well, Bill, just have one comment on that. Somebody just said that it might be useful to go back with some very well-studied chemicals where we think we know the mode of action or the primary mode of action and look using systems biology approaches to see what we might have missed. And I think that also gets to your point that there may have been, at the time those studies were done, a set of assumptions or inferences that really need to be examined more thoroughly, either to determine whether there are additional types of endpoints that were missed because of the nature of the dosing, high-dose studies, et cetera, or because it could provide new insights into what the systems biology information could allow us to detect that we didn't see in those original studies.
Right. I'll be quick on the second one, and it really gets at Maurice's two options. And I guess my comment on that is that, we've, for a number of years now, talked about the sort of holy grail of a biologically based dose response model and trying to really understand that. Justin talked about the successes that we've had with PBPK and the ability to do that from the standpoint of internal doses. But I think we really need to look at the systems approach in terms of understanding BBDR. And I really question whether or not, in the absence of the ability to do that, we should continue to use the kind of approaches that have been used simply because we can generate a number. Again, I think we've tried to put those numbers in context and have not always succeeded by talking about the uncertainties associated with them and the upper bound nature and so on. But we're really trying to do some things differently, I think, as we use systems biology to do biologically based dose responses.
Yeah, I'm glad you asked that question, actually, because, in my endeavor to try to provoke discussion and, simplify my arguments, I possibly given the impression that, whatever works, to some extent, particularly in my context in Europe, what we're trying to do, people want solutions like now, and so absolutely, but I suppose absolutely, but if our trajectory is still clearly defined, so we know we won't get there tomorrow, and we won't get there, but I'd be much happier. Embracing kind of using the tools we have and the way we have and being, I love that slide of Greg's where and here the miracle happens. Now, let me translate that slide into, sorry, digress a moment, but it really hit home. Often when we go through a lot of validation processes and you end up with one assay, and you've effectively validated that it's reproducible. So it's reliable, but at the end of the validation, and I'm exaggerating, but often the case you say, well, but I'm still unsure about the relevance of how to use this to predict skin sensitization or whatever. And the usual catchphrase is, well, it can't be used as a standalone assay for effect X, but could be used in an integrating testing strategy in the future. Now, for me, that's where, and then the miracle happened, you know. So I think we need to be clear about, obviously, the test system we're using now and the assumptions we're making and the gaps and so on. And as I said, if it works and we haven't got any alternative, absolutely. But at the same time, we will fall into a big trap if we start getting comfortable with that, because we won't move we won't really develop further. We just have other tools in our toolbox. Okay.
All right, we got 2 minutes and 13 seconds left in this session. So,
okay.
So
Pat Cassano, GE. The second question asks about risk assessment problems particularly amenable to using this kind of data in the near term, and it seems to me that there are two. One is the question of whether there's a threshold, and the other is whether there are significant differences in sensitivity between species. And I'd like your views on that.
So, in terms of individual threshold, people have used transcriptomic data because of fairly high sensitivity to march down the dose response curve. And there's some really nice papers out of the Hamner Institute on formaldehyde and dose-dependent transitions. We've done some stuff with various estrogens. So it's possible. The problem with translating that is, of course, from a population threshold standpoint, there are all kinds of other issues that one needs to deal with. But I think it's definitely worth proceeding simply to determine what you can do in terms of informing shape of dose response curve and kinds of effects that one might get at lower levels than where we do our traditional histopathology-based studies. So in that sense, yeah.
Just real quick, George, is it possible to prove or disprove the existence of a threshold at the population level?
I actually think yes, but it's going to be through a real understanding of what drives the variability at the population level. So we do need to have that first. Isla?
I wanted to respond to something Maurice had said about it not being clear about next gen and kind of next steps. And I think that's been a little deliberate in the sense of listening to organizations like this. There was an SAB review a couple of weeks ago about what should be next, in the sense of we can just say, the science is just not there, so we should do more research. We should go gangbusters and just make the switch, which I haven't heard anybody say, or something in between. So any specific guidance, or comment on that would be of value, and people have identified some places. But the place that people have not said much about, I heard that at the high production volume screening kind of level and at the kind of tier 3 level that people felt there were opportunities for progress. But, in that tier 2 level where you're not using a lot of traditional data, but you want something more than high throughput screening, I haven't heard anybody comment on what might be the opportunities there. And the examples that I had, kinds of data we might rely upon would be the acute exposure, transcriptomic kind of work like Rusty Thomas is doing, or alternative species work. There's several models in there that I'd like just people to comment on.
I'd like for them to, but unfortunately I have a hard stop that I had to make, and I apologize to you, Steve, because I really do need to end this and give Dan Kruski the opportunity to make his closing comments. So there I think is a lot of opportunity to provide comments back to either the committee or to EPA in general. Let me just finish by thanking the panel for their really great insights, and also thanking EPA for recognizing the fact that we support that you have a very difficult job and appreciate that you're trying to find better ways to get it done. Thank you.